The importance of hand hygiene in hospitals. Do you know what makes up your soaps? When was the last time you really thought about how long you washed your hands? Did you make sure you properly scrubbed your hands for 2 minutes? Have you noticed how doctors and nurses constantly reapply hand sanitizer while working with you or other patients? Do you wonder what the difference between regular soap and antibacterial soaps were? Yeah, probably not. So, we present you the importance of hand hygiene and what exactly makes up certain cleaning soaps or hand sanitizers.
History of soaps. Soap was used for the first time in ancient civilizations for both hygienic and spiritual rituals. In order to make the soap, they boiled animal fats, which acted as the lipid, and mixed that with ashes, which acted as the soap. Later, in the Middle Ages in England, hand hygiene remained important while the bodily hygiene became less prioritized. In the 19th century, Semmelweis, the father of hand hygiene, tried to implement a disinfectant before delivering babies, in which positive results were found, yet people did not agree with his ideas, and he was admitted to an insane asylum. In the mid-1980s, the first national hand washing guidelines from the CDC were published in the United States. In the mid to late 1990s, nurses in the United States switched to hand sanitizers or alcohol-based hand rubs due to not having time to perform the recommended 2-minute hand washing routine between patients. Structure of lipids and why they are important. Lipids are a fatty acid that are used in soap. Soaps have a triglyceride backbone with a carboxylic acid, salt. Lipids have a polar hydrophilic head, which is shown in pink, and a nonpolar hydrophobic tail, which is shown in teal. The tails are also lipophilic, which means that they're lipid-loving, which allows them to break down oils as like dissolves like.
How regular soap breaks down dirt and other germs. Using regular soap and water is the most effective way to remove germs and dirt from the body. When greasy dirt or oil is mixed with soapy water, the soap molecules arrange themselves into micelles. First, the hydrophilic part of the soap molecule sticks to the water and points outwards, forming the outer surface of the micelle. The hydrophobic parts stick to the oil and trap oil in the center where it can't come into contact with the water. With the oil tucked safely in the center, the micelle is soluble in water. As the soapy water is rinsed away, the greasy dirt goes along with it.
The structures of alcohol-based hand sanitizers. They're a form of ethanol and isopropanol, and their active ingredient is ethyl alcohol. 60 to 95% of these hand sanitizers are made up of alcohol, and they get rid of bacteria by denaturing the lipids and their proteins. They break down the bacterial cell walls, which are made of the phospholipids. Hand sanitizers are claimed to be 99.99% effective on killing microscopic invaders due to their high content of ethanol. The percent average of alcohol present in most hand sanitizers ranges from 60 to 90%. Hand sanitizers were originally made as a quick alternative for washing hands in hospitals for healthcare workers and is now commercialized for everyday use. Though proven to be as effective as it is, it's not a substitute for the traditional way of washing your hands with soap and water because they just kill germs and bacteria and do not remove it from your skin.
Antibacterial soap. Not as great as you thought. Antibacterial soap is often advertised as being a more effective alternative than regular soap. Yet studies show that antibacterial soap is actually worse for not only humans, but also the environment, due to the compounds that make it antibacterial. Antibacterial soaps contain high amounts of triclosan, an antibacterial and antifungal agent. When the bacteria is exposed to triclosan, it can undergo genetic mutations that protect them from triclosan, and eventually make them more difficult to kill with antibiotics. On the right, you can see the IUPAC name of antibacterial soap, which is 5-chloro-2,2,4-dichlorophenoxyphenol.